Hi Max, my name is Kelly. I'm going to be your nurse today. Please let me I'm going to shut the door and also wash my hands. When I walk through the door, I am checking for the patient's body language, his appearance, and if he looks relaxed and comfortable. I am also looking at his respiration, seeing if anything abnormal jumps out at me. Next, I'm going to check for his alert and orientedness. Max, what is your name and date of birth? Perfect, that matches your wristbands. And do you remember my name? And do you know where you are? And do you know what month it is? Great, good job. So now I can say that he is alert and oriented times 4. And his nonverbal cues and his speech are all very relaxed and clear. Next, I'm going to look at his head and neck. His skin around his face looks very normal with no lesions or rashes or anything that jumps out at me. And now I'm going to check his eyes. Max, please follow my pen, looking straight ahead with your eyeballs without moving your head. We're going to look up, down, to the side, and on some angles. Great, Max. Now I'm going to shut the lights off. And if you can look at that picture enough far away, I'm going to shine a light into your eyes. Good, now look from the picture to my ear. Good job, good job. Now I'm going to look inside his mouth. I'm going to look at his tongue to make sure his tongue looks normal and no lesions, and his gums are pink and moist, and also his lips are moist. So now I can say that he's alert and oriented times 4. And next I'm going to have him turn around, facing away from me. I'm going to put both my hands on his diaphragm, and I'm going to make sure that when he breathes in and out, his diaphragm is contracting and relaxing equally. Next, I'm going to have him lean forward, and I'm going to listen to his point of maximum impact. This is located in the mid-clavicular line in the 5th intercostal space. You gonna like it? Good job, that sounds good. Now I'm going to look at 5 different heart sounds anteriorly. The first one is going to be the aorta, located in the center, in the 2nd intercostal space on the right side. The second is the pulmonic, which is the 2nd intercostal space on the left side. The third is the Erb's point, which is the 3rd intercostal space on the left side. The 4th is the tricuspid, which is the 4th intercostal space on the right side. And the 5th is the mitral, which is in the 5th intercostal space in the mid-clavicular line. Great, next, your heart sounds great with no murmurs, rubs. Now we're going to look at your lung sounds. I'm going to check 5 different lung sounds on the left and the right, anteriorly and also posteriorly. Great, I looked at the vascular sounds, the bronchial vascular sounds, and the bronchial sounds. anterior and posteriorly, and they both sound great with no crackles, rhonky, or wheezing. And now that we looked at that, we're going to look at his abdomen. So Max, if you can please roll over. Good job. First, I'm going to auscultate his abdomen. I'm going to listen to his abdomen in each of the 4 quadrants. Great, that sounds normal with 5 to 30 gargles in each quadrant per minute. Next, I'm going to lightly palpate and then deeply palpate the organs to make sure that there are no lumps, lesions, tenderness, or edema. Good, everything feels great, and based on his nonverbal cues, nothing was tender or uncomfortable, and there was no guarding. And next, when was your last bowel movement? And have you had any problems going to the bathroom lately? Perfect. And now I'm going to check your radial pulse for 1 minute to be sure that it's normal. Good boy. Now we're going to check the strength of your upper and lower extremities. Okay, so Max, sit. Come on. Come on. No, don't run away. Sit. Good job. So if you can please push up against my hand and push down against my hand, and then push my hand away. Good job. We're going to do it on this side. Push my hand up, push my hand down, and then push my hand away. And now squeeze both my 2 fingers as hard as you can. Good job. Good job. And we already checked for your radial pulse, and now we're going to check your lower extremity. So Max, lay down. Max, lay down. Sit down. Good job. Stay. So we're going to check that he can push up against my hands, push down against my hands, push my hand away this way, push my hand into his body on both legs, and also flexing the foot and flexing the foot. Extending the foot and also flexing the foot. Next, we're going to check the posterior tibialis pulse, which is right here. And also the dorsal pedis pulse, right here. Good, now we're going to check capillary refill time on the upper extremities. Good, it's under 2 seconds. Stop. In the lower extremities, by squeezing the finger or the toe to make sure that the blood refills within 2 seconds. Good, that looks good. Good boy. Max, do you have any questions or concerns today? No, you're going to get a treat, don't worry. Perfect. And throughout this whole exam, I'm looking at his skin and his nonverbal cues to make sure that everything looks normal and he's comfortable with all the procedures that I'm doing, and that there's no guarding or tenderness or uncomfortableness. Thank you, Max. I'm going to make you safe in your bed. Okay? Here's your call, so you can call me, and I'll be back to check on you in a little bit.